So we're going to discuss about a drug called Aciclovir. So each tablet of Aciclovir contains either Aciclovir 200 mg or 400 mg. So how does this drug act? Okay, so this drug Aciclovir is converted to aciclovir monophosphate, a nucleotide, by the viral thymidine kinase of herpes simplex virus and varicella zoster virus. So aciclovir monophosphate is converted to the diphosphate by cellular guanylate kinase and to the triphosphate by a number of cellular enzymes. So aciclovir triphosphate interferes with herpes simplex virus and also varicella zoster virus DNA polymerase and inhibits viral DNA replication. So aciclovir is a drug that inhibits viral DNA replication, and then the triphosphate can be incorporated into growing chains of DNA by viral DNA polymerase, resulting in termination of the DNA chain. So absorption, the bioavailability is about 20%, so the range is about 15 to 30%. It's poorly absorbed from the gastrointestinal tract, and it is not significantly affected by food. It's widely distributed to tissues and body fluids, including brain, kidneys, lungs, liver, aqueous humor, tears, intestines, muscle, spleen, breast milk, uterus, vaginal mucosa, vaginal secretions, semen, amniotic fluid, cerebrospinal fluid, and also herpetic vesicular fluid. The highest concentrations are found in kidneys, liver, and intestines, and CSF concentrations are approximately 50% of plasma concentrations, and this drug crosses the placenta. So the volume of distribution for adults is about 48 liters per square meter of body surface, and for children and adolescents between 1 to 18 years old, it's approximately 45 liters per meter square. For neonates, there is the ones between 0 to 3 months old, it's approximately 28 liters per meter square. And for patients with end-stage renal disease, the VD volume of distribution is about 41 liters per meter square. Protein binding is low, between 9 to 33%, and biotransformation is hepatic. It occurs in the liver, and the only major metabolite found in the urine is 9-carboxymethoxymethylguanine, which represents about 9 to 14% of the dose, and the metabolite has no known antiviral activity. The half-life for oral concentration is 3.3 hours. And time to peak serum concentration for oral dose is 1.7 hours. So the half-life of the drug for patients with creatinine clearance of more than 80 mL per minute is about 2.5 hours. So when the creatinine clearance is reduced to about 50 to 80, the half-life becomes about 3 hours. And then if the creatinine clearance is 15 to 50 mils per minute, the half-life is about 3.5 hours. In anuric patients, the half-life is 19.5 hours. During hemodialysis, the half-life is 5.7 hours. Patients having continuous ambulatory peritoneal dialysis, the half-life is 14 to 18 hours. With regards to elimination, the renal excretion is by both glomerular filtration and tubular secretion. So you also have oral elimination, where about 14% of total dose excreted unchanged in the urine. In the feces, it's less than 2%. And you might see trace amounts in exhaled carbon dioxide. So with regards to dialysis, for hemodialysis patients, a single 6-hour period of hemodialysis reduces plasma aciclovir concentration by approximately 60%. And with regards to peritoneal dialysis, it does not significantly alter the clearance of aciclovir. So indications for aciclovir include treatment and prophylaxis of herpes genitalis, treatment of herpes zoster, herpes simplex, and also varicella. This drug, aciclovir, is contraindicated in patients who have developed hypersensitivity or tolerance to the drug, which I think is quite obvious. Adverse reactions, general ones, include fever, headache, pain, peripheral edema, and rarely anaphylaxis. For the central nervous system, the adverse reactions, unwanted effects include having confusion, dizziness, hallucinations, paresthesia, and also somnolence. Okay, so you might become sleepy after taking this drug, and these symptoms are more clear and more apparent in older patients, in the elderly. With regards to the digestive adverse reactions, it includes having diarrhea, elevated liver function tests, GI distress, and also nausea. The hemic or hematopoietic and lymphatic effects include having leukopenia. Okay, you have low white cell count and lymphadenopathy. Okay, swelling of the lymph nodes. And also, with regards to the musculoskeletal system, you might develop muscle pain, myalgia. In the skin, you might develop alopecia. Okay, loss of hair, pruritus, itchiness, rash, and also urticaria. And when it comes to the special senses, you might develop visual abnormalities. So precautions: acute renal insufficiency may happen due to the precipitation of the drug in the renal tubules, and this is more likely to happen if aciclovir is given by intravenous injection in a rapid manner, together with known nephrotoxic medications, to patients who are not adequately hydrated, or to patients with renal function impairment without appropriate reduction in the dose of aciclovir. However, it has been reported in patients receiving, acute renal failure has also been reported in patients receiving oral doses of the drug. With regards to the neuropsychiatric toxicity, this has been associated with high concentrations of aciclovir in the plasma, which may happen when high doses are given, or when patients with impaired renal function are not given an appropriate dose lowering. And neuropsychiatric toxicity, as mentioned in the adverse reactions, is more possible to occur in patients who are immunocompromised and also geriatric patients. So with regards to pregnancy and lactation, for fertility or impairment of spermatogenesis, with regards to fertility, now we will talk about fertility first and then we will talk about pregnancy. So with regards to fertility, we have not documented, in humans it has not been documented, we have not documented any impairment of spermatogenesis, problems with sperm motility or morphology, so we have not seen that. However, parenteral aciclovir, which were given at high doses, have caused testicular atrophy in rats and dogs. And 30 days after the dose, there was some evidence of recovery of sperm production. And studies in mice, which were given oral doses of up to 450 milligrams per kg per day, so which is a very high dose, showed that aciclovir did not impair fertility or reproduction. So this is in mice. And with regards to studies in female rabbits, that were given subcutaneous aciclovir, it showed that a significant decrease in implantation efficiency, but there were no decrease in the litter size at doses of 50 milligrams per kg per day. So pregnancy, aciclovir crosses the placenta, as mentioned previously. And it has been used in all stages of pregnancy, especially in the 3rd trimester, but so far no adverse fetal effects have been reported. And there was one small control study that showed that prepartum treatment of women with recurrent genital herpes helped prevent symptomatic recurrences and viral shedding at the time of delivery, and thus reducing the risk of infants being exposed to the virus. However, adequate and well-controlled studies in humans have not been conducted. Studies in mice given high doses and also studies in rats and rabbits given subcutaneous doses have shown that aciclovir does not cause adverse effects in the fetus. And therefore, what was recommended is that aciclovir should not be used during pregnancy unless the potential benefit outweighs the potential risk to the fetus. Okay, see you in the next video. Thank you.